The foods to eat to lower blood pressure. 1. Citrus fruits. Citrus fruits, such as grapefruit, oranges, and lemons, may significantly reduce blood pressure. They include a wealth of nutrients, including vitamins, minerals, and plant chemicals, which may protect your heart by lowering risk factors for heart disease, such as high blood pressure. A 5-month study including 101 Japanese women found a strong correlation between daily lemon juice consumption and walking and decreases in SBP. The result was attributable to the citric acid and flavonoid content of lemons. Consuming orange and grapefruit juice has also been linked in studies to lower blood pressure. However, before including this fruit in your diet, speak with your doctor because grapefruit and grapefruit juice may interact with common blood pressure lowering drugs. 2. Salmon and other fatty fish. Omega-3 fats, which have a major positive impact on heart health, are a fantastic source of fatty fish. By reducing inflammation and oxylipin levels, which constrict blood vessels, these fats may aid in lowering blood pressure. Increased consumption of fatty fish rich in omega-3 has been associated in research to decrease blood pressure readings. Those with the greatest blood levels of omega-3 fats had considerably lower SBP and DBP than those with the lowest levels of these fats, according to a study of 2,036 healthy individuals. A decreased risk of hypertension has also been linked to higher omega-3 intake. 3. Swiss chard leaf. Swiss chard is a leafy green that is rich in minerals that control blood pressure, such as potassium and magnesium. 1 cup, 145 grams, of cooked chard provides 17% and 30% of your daily requirements for potassium and magnesium, respectively. Every 0.6 gram daily increase in dietary potassium is linked to a 1.0 mm Hg reduction in SBP and a 0.52 mm Hg drop in DBP in people with high blood pressure. Swiss chard contains 792 mg of this significant vitamin per cup, 145 grams. Magnesium is also necessary for controlling blood pressure. It does this by acting as a natural calcium channel blocker, which prevents calcium from entering heart and artery cells and lowering blood pressure by enabling blood vessels to relax. 4. Pumpkin seeds. Despite their diminutive size, pumpkin seeds are incredibly nutritious. They include concentrated amounts of nutrients that are crucial for regulating blood pressure, such as magnesium, potassium, and arginine, an amino acid required for the generation of nitric oxide, which is necessary for relaxing blood vessels and lowering blood pressure. Additionally demonstrated to be a potent natural treatment for high blood pressure is pumpkin seed oil. In a 23-woman trial, supplementing with 3 grams of pumpkin seed oil daily for 6 weeks resulted in significantly lower SBP than a control group. 5. Beans and lentils. Fiber, magnesium, and potassium are just a few of the minerals found in beans and lentils that help control blood pressure. Eating beans and lentils may help lower high blood pressure levels, according to numerous research. In comparison to other diets, beans and lentils significantly lowered SBP and average blood pressure in persons with and without hypertension, according to an analysis of 8 trials including 554 participants. 6. Berries food. Berries have a number of remarkable health advantages, including the potential to lower risk factors for heart disease like high blood pressure. Antioxidants, such as anthocyanins, the pigments that give berries their vivid color, are abundant in berries. Anthocyanins have been demonstrated to raise blood levels of nitric oxide and decrease the synthesis of blood vessel restricting molecules, which may aid in lowering blood pressure. However, additional human study is required to validate these proposed processes. Some berries that have been linked to decreasing blood pressure include blueberries, raspberries, chokeberries, cloudberries, and strawberries. 7. Amaranth grains. Consuming whole grains, such as amaranth, may help decrease blood pressure. According to studies, eating a diet heavy in whole grains may lower your chance of developing high blood pressure. An increase in whole grain consumption of 30 grams per day was linked to an 8% lower risk of high blood pressure, according to a study of 28 research. A whole grain with a high magnesium content is Amaranth. A cooked cup, 246 grams, supplies 38% of your daily needs for magnesium. 8. Pistachios food. Pistachios are very nutrient dense, and eating them has been associated with normal blood pressure levels. They include significant amounts of potassium and other nutrients necessary for controlling blood pressure and maintaining heart health. An evaluation of 21 research discovered that pistachio consumption had the strongest impact on lowering both SBP and DBP of all the nuts included in the review. 9. Carrots vegetable. Carrots are a common vegetable in many people's diets because they are healthy, sweet, and runny. The phenolic chemicals found in high concentrations in carrots, such as chlorogenic, p-coumaric, and caffeic acids, relax blood vessels and reduce inflammation, which may lower blood pressure. Carrots can be eaten either raw or cooked, although eating them raw may be better for lowering high blood pressure. According to a study with 2,195 participants aged 40 to 59, eating raw carrots was strongly linked to decreased blood pressure. Another small trial with 17 participants found that drinking 16 ounces, 473 milliliters, of fresh carrot juice every day for 3 months reduced SBP but not DBP. 10. Celery vegetable. A popular vegetable called celery may help lower blood pressure. It contains substances known as phthalates, which could aid in relaxing blood vessels and lowering blood pressure. The same study that linked eating raw carrots to lower blood pressure also discovered that eating cooked celery, a typical cooked vegetable, was strongly linked to lower blood pressure.